Yeah, thank you for reminding us. This is very helpful. Okay. So now we have the health services. We already talked about like 3 points. We have to.
One question: is low capacity related to training and education?
Yes, low capacity. Yeah, it means that they need specific trainings, like very specialized training.
Okay, thank you.
Yeah, that's why we didn't say low capacity and we stopped. We mentioned in low capacity in this. It could be low capacity.
I understand. Thank you.
You're welcome. Yes, I think someone else was about to talk. Hayat, I think it's you were talking, or someone else. I don't know. Yeah, so what else we can say? Maybe do we think they need only training on an IMCI, or for example, usually when we talk about health centers, especially in rural areas, maybe we need to maybe low capacity. Maybe we can mention more. And if you know about EMOC, I don't know, Muhammad, if you know more than me now in terms of these kind of trainings. Do they still provide it or no?
Yeah, they still provide it, but why we don't say reproductive health in general? Like,
the more we are specific, the more, and maybe we can say,
all right,
and maybe reproductive health. I think we can have it very separated.
Specifically, yeah.
Low capacity, and we have a very strange weather here in Amman. It's really very cold. Okay, low capacity in maybe reproductive health and family planning. Maybe we can see it like as a different point. And family planning counseling, maybe just to make it very specific. Okay. So now we talked here. It's not enough, but so far so good. How about health facilities? We talked about shortage of medicines, shortage of equipments.
Yeah, old health facilities needed, for example, rehabilitation or expansion.
All health facilities that need rehabilitation and expansion, maybe. Okay, that's good. What else? All for the health facilities, do they all have, let's say, are they all connected to water sources? Do they have, for example, like
they should be actually,
but
they should be connected to water source, or maybe we can say old health facilities in need of wash interventions.
Okay, so maybe it could be part
like
of the rehabilitation, but it could be part of the rehabilitation, but we could add it.
Yeah.
Dr. Adil, we can add in the previous section the lack of female health service providers.
Yes, we could add this. Unavailability of health workers in many health centers, especially maybe we can add it to this point.
Okay.
Especially female service, female nurses, and let's see, and okay. So we can see especially midwives.
Okay.
Okay.
Sorry, doctor, just to, if we can just paraphrase this, all the health facilities that need rehabilitation and expansion. So can we paraphrase it to poor condition of facilities, poor condition of
Yes. We can see that. Yes, conditions.
Thank you.
In health facilities okay, that need rehabilitation and expansion. Okay, nice.
Thank you.
Are we talking about clinics or inpatient facilities?
Yeah, it could be clinics, but usually we are here focusing on the public managed health facilities, not the private clinics, for example.
No, I mean, are these outpatient type services, or are they inpatient hospitals?
Usually, only there could be just one that have inpatients, but all others, they are like a peripheral services.
Yes, that's right.
Okay. Okay, what else do we have here? In the health facilities, maybe water services is not connected to all health facilities. Sometimes it's just this, water services is not connected, although sometimes it's tricky because it looks like a water project, not a health project when we talk about water.
Okay. Yeah. We can say, or maybe we can say water and electricity unavailability in the health facilities.
Okay. Okay, shortage. We will make it this shortage because I need to separate them so that once we design the activities, we don't neglect important activities. Shortage of electricity. Okay, electricity in many health facilities. Okay. Can we see a shortage of equipments and furniture, or we can have it a different point in terms of furniture? I think it could be different. In the health facilities. Okay. We will not repeat in the health facilities because we are talking about health facilities. Okay. Shortage of basic furniture, like chairs, are like chairs for patients who are in the waiting, or sometimes just like the office and desks, chairs for the health service providers. Okay, so I think we try to cover many things, not everything for sure. If we go and do need assessment, we could bring more points here. Okay, let's we didn't talk about health authorities. What's the problem with them?
Yeah, I was going to talk about that. No supervision from local authorities or health offices on these health facilities.
Okay, low supervision of the quality, maybe, and continuity.
Yeah. Restrictions, I guess, voting restrictions.
Well, actually, it's a public facility, so it's run by the facilities, by the authorities. Doesn't need any facilitations.
Yes, because it's within their scope of work, so they can go
Yes.
without getting permission from the government, because they are already the government.
Sorry, I think it's prefer to add the authority with the health service provider, because this is who supervision of the health services provider. What do you think, Brother Adel?
We could see this, but like what we mean is here is that low supervision of the quality and continuity of work in the health facilities by, maybe we can see by the health authorities. I think we can just see this so that we make it very clear. Because the supervision of the quality, it means they will take or they will consider everything related to the quality in terms of the capacity of the staff, the tools, the equipment, the availability of everything, and working on time, everything related. Yeah, I think we covered many aspects here. Okay, how about the community?
I guess a huge number of needy people to these health services.
Could you repeat it again, please?
Huge number of patients, or
okay.
I don't know if it's related or not.
Maybe yes. You mean high demand, like the
yes, high demands, you can say. Yes, sure.
I think the problem is that sometimes we, like what we notice is that people usually go to the health centers in late stages, so they could be very sick and still they don't go.
So lack of awareness of the right.
Lack of awareness and
lack of awareness.
Health education.
Okay, so lack of awareness.
Health awareness, I guess.
Health awareness.
Awareness.
Okay, so lack of awareness of
no. Of health.
Yeah, you mean here lack of health awareness.
Yes.
Okay.
Yes, exactly.
We can explain it. Let's say lack of awareness of the services provided in the health facilities, and how to. Okay, I think that's enough. If we are focusing, let's say on if we are talking about, I mean, in general, especially the maternal health, usually the community, they don't care if the let's say to do antenatal care and like making sure that it's a safe delivery in the health center, in the health facilities. What they usually do is that they do delivery at home, making the mother under risk and the baby. So lack of awareness of the importance and
the antenatal care. Yeah.
Yes, antenatal care and safe delivery services.
Dr. Adil, we can add the lack of awareness of the importance of the immunization of the children.
Yes, this is a big issue. Yes, awareness of the importance of
vaccinations.
The vaccinations for their children. Okay, vaccinations in general.
Childhood illnesses.
Yes, against okay.
Yeah, we may add inaccessibility of the community to the health facility. For example, if they are far away or there is no road to the health
Okay.
facility. Yeah.
Yeah, usually it could be here if we think they are very far, but still we will not be able to. And this is a really good point. Usually, what we advise participants, like usually once you design a project, if there is a point that you feel like you will never be able to solve in the project, it would be much better not to mention. That's the idea. So, for example, we can see this health facilities are very far from or are very far and
Far away from the community.
Far away from beneficiaries.
From beneficiaries or from let's say we took now at this level we don't talk about beneficiaries, they are still patients, let's say.
Yes.
From patients and because it's usually it's not very far from everyone, but from patients in remote villages. Okay. Are we satisfied now?
Yeah, Noura Ghadi mentioned that lack of financial status for the patients or people need.
Here could be people are yes. We can see people could not or cannot afford the cost of the health.
Affordability. You can say affordability matters.
Yes. Yes. So people like short, they are now because of the war, they cannot. Sorry, I didn't write this. People cannot pay for the services. Okay. Sometimes this, although we talk about community, but sometimes here it could be under the health facilities. It could be here.
Yes.
But it's fine if we make it in the community. It's fine. Okay. As you notice here, everything we were talking about is related to health. We never mentioned anything related to nutrition. So it's mainly health. Okay, so now if we are going to describe this, you can't imagine how much the weather is bad now.
You can see
a lot of rains and terrifying. Okay, so let's yeah, let's describe the health service providers. Can we describe them here, the effect on responsible entities? We can say health service providers with, let's say, with shortage of capacity and tools to respond,
to maintain their work.
Maybe
to maintain
to provide or to
yes, to maintain, to provide.
Okay, to provide high quality services for example. Okay.
Or
How about
Dr. Adil, we can see the weaknesses of the health service provided by the health providers or with the health cadre.
Yes, yes. I try to use this like a shortage of capacity or with low capacity, we can say. But I said shortage just to describe the capacity and the tools. Or we can say of low capacity and shortage of tools. We can use low with low capacity and shortage of tools to provide
High
quality services. Okay. How about the health facilities and authorities?
Okay. Infrastructure of health facilities.
Okay, the infrastructure. Okay, the infrastructure of the health facilities.
It's poor. It's poor.
Is poor and
Poor.
is poor and with low support and supervision from the health authorities. I think it's good now.
Okay.
Okay, let's describe the community that has lack of awareness on importance of many things. So people in targeted areas do not, I don't know, okay, lower, lack of awareness how can we describe this, especially, for example, importance of antenatal care and safe delivery, and we have the vaccination. I mean, this is very critical.
The importance of the antenatal.
Okay, so people in the targeted area lack of awareness and
the importance of the
yeah, but I don't want to repeat it. That's
okay.
Yeah, it should be.
Okay.
We are speaking about the impact.
Yeah, it's like how the impact at their level, and then we will talk about the suffering of the patients in the harms. Because now it's just
we can't say that the children the children have not IMCI and vaccination services. We cannot say it here as an impact.
we don't see the harms on let's say mothers and children, only in the harms. So once we talk about the harms on the affected people, we talk about here. But now it's still we talk about like parents, people in general. Here we talk about infrastructure. Here we talked about health service providers. So they are responsible entities because we decided here that they are responsible.
Okay.
Because
health awareness. Can we say lack of health awareness?
Yeah, maybe yes, maybe lack of health. Let's say lack of health awareness.
Yes.
And unable to pay for the services and able, maybe we can describe like for the services. Although it's not really describing,
or unable to afford the health services.
Afford, yes.
Yeah,
Just unafford.
and are not they cannot afford. Okay, although it's repeated, cannot afford the cost of maybe we can say emergency services, or we can say just the services, the health services. Okay, so if that's now when we see all these like three elements, we have health service providers, low capacity and shortage of tools, and then infrastructure and the health facility environment is poor. I mean, everything in the health facility need improvement. Then we have people with low capacity, unable to pay or afford the costs, and they are not aware. All of this will lead to the harms. It means that we will have vulnerable, maybe we can say vulnerable people, especially women and children, with increased maybe we can say are not receiving the health services they need to save their lives,
or educate. They are not receiving educate health services.
Yes, adequate. Yes, adequate health services they need to save their lives and keep suffering from diseases and illnesses. Like I'm trying just to talk about it. I mean, even if it's not the best way to write it, but it's fine. We can say with they need to save their lives and keep suffering from diseases and illnesses. And when we see harms on the community, if this suffering continued many times, we will see increased rates of morbidity and mortality. You know, morbidity and mortality means a lot of sick people and a lot of death in the community, and mortality in the community, especially among the high vulnerable people. Okay, I think as we are good now. Again, I'm satisfied maybe 85%, maybe 90%. Still, if we go through it, we can change some sentences, we can improve some sentences, so that we feel it's already great. Okay. Any question at this level? I will go through your chats here. Okay, so lack of financial status of patients. Okay, I see Nora wrote here, and also okay. Okay, we have okay, Najwa, can you yeah, you can ask.
Thank you, Dr. Adel. I have a simple question here. I noticed
Yes.
that we are just writing all our thoughts and ideas simply. We are not caring about. I noticed when you mentioned we don't specify here beneficiaries. That means all the thoughts we have in our mind, just put them in the problems tree, and all the details and our attention will be more and more in the coming steps. Is that right? Thank you.
Usually when we do this analysis, we decided that beneficiaries, like the main problem here is actually their problem. So we talked about them, but we don't talk about them in numbers, because as I think it was you who asked. Usually we can't bring very clear numbers, but we can use let's say we can use numbers that we need to make sure that this is the most correct number. If we do the need assessment, we can bring like the numbers in much while we are more confident. But at least now we talked about them here, and we talked about them like in the main problem. Also, we talked about people here in the awareness, and everything related is here related to the responsible entities. And then we talked about them in the harms. So this is mainly the harms, and when we do the project, we should make sure that these harms are removed. So when we conduct or when we implement this project, we should improve this. So people should receive adequate health services, and also they should not suffer anymore from diseases and illnesses. At least they can receive medications and health services. I mean, in general. Yes, Baraka, yes.
Oh, thank you, Dr. Daly. I'm sorry if I might ask something maybe in a proper place. I joined late a bit. I could not get to the access area.
Yes,
at least I wanted to know, maybe you will give me an instruction for the future on how we can go forward based on our side, because we haven't even shared the title for proposal, and even I could put even the access for yesterday's recording session. So please, in case, yes.
Okay, so let's agree on this. We will, for sure, tonight we will send you the links. That's one thing. So you will have the chance to go through most of what we were talking about, and then we will devote more time for you to do the analysis of your proposal, and then we could work together like on the next steps. So we will have the chance to cover everything. But now please share your email with Olga or in the chat for those who are not added yet to portal, so that you start you start creating your proposal, and then we go forward. Nader, I think Nader, you raised your hand.
Yes, Doctor, thank you. About this proposal, we talk about the malnutrition. I mean, when we talk about women, or we talk about pregnant women, lactating women, about the children, but we talk about the children under 5.
Yes.
What's about this?
Yeah, I think I mentioned that that this project is now it looks like only health services. It's not including the nutrition part. So we didn't talk about, for example, awareness related to breastfeeding, related to let's see how to. We didn't mention that we will have. For example, community health volunteers. We didn't talk about low capacity of community health volunteers and measuring the MWAC, for example, or anything related to nutrition. So it's all health services.
Okay,
that,
noted. Thanks.
yeah, and even when we talked about the pregnant women, we didn't talk about that they are more vulnerable to malnutrition and under 5 children. We just mentioned about family planning, reproductive health. We mentioned about antenatal care, safe delivery services. So we focused on basic services. Thank you. Yeah, it's a very important question. So Olga, I think please add Baraka, or I think I add him yesterday. So
yes,
Baraka,
actually he is already in the system. You added him yesterday. He had access to the portal.
Okay, great. So now I don't know if we should have a break for 5 minutes. So for those who didn't have their coffee yet, but just let me go through the presentation very quickly for the other parts that we didn't cover yesterday. In general, once we have this, we can have some questions, and then we go to like, for example, anything that was mentioned here in the problems tree, it could be it become a question. For example, if we are going to do a need assessment, we need to ask about everything that is mentioned here. So for example, we can have a question of we will have questionnaire for health service providers. We will have questionnaire for health authorities. We will have questionnaire for communities, and then we collect their answers, and we start to draft the need assessment. So for example, for health service providers, we will ask them about incentives. Do you receive incentives on monthly basis? Do you receive your salaries? Have you been trained on IMCI? We will also ask the let's say the authorities, and also we will ask maybe even the community if the health service providers are available all time on, or maybe just like very limited time on the health facilities. We will talk about emergency obstetric care. So for those who doesn't know about EMOC, it's emergency. Sorry, I wrote only the abbreviation, emergency obstetric care. This is related to antenatal care and safe delivery services. Or emergency, yes. Okay, so now low capacity in reproductive health and family planning. We will ask about have you been trained on, I think I lost the link, and we came back. Okay, great, we could come back. Okay, let me share with you the Excel sheet again. I don't know why I lost the link. Yes, generally, so we could have questions for everything, and we ask, and then we create the need assessment report, and we use it as we use it as part of, or as evidence that the need is actually was collected from the community. So usually now we can paraphrase, we can make this paragraph as a need assessment. So I will ask Muhammad Al-Maghbashi, you could go to your proposal, and sorry, I will share portal. So you need to go to your proposal, and you go to background, you go to need assessment, and start a copy paste the same thing we mentioned. So for example, Muhammad, can you add me as to your project?
All right, okay.
Because now I cannot do anything.
Okay, done, Dr. Adel.
Okay, so let me refresh the page so that I can work with you together while, yeah, so now I am already added as a responsible for the project. So we go to the background, and you will work on the context analysis, but for the need assessment, this is the paragraph we were working on. So we mentioned that usually what we do is we do copy paste from the Excel sheet, and we come here, let's say, if we collected we can see, because now you are in an FDHR, so we can say an FDHR has conducted a need assessment and found out that, then I will do just copy paste, found out that people okay, okay, but there are many people in acute need acute need of health services, especially women and children in Bani Matar district. Okay, sorry. Okay, I will keep a copy paste. Then Bani Matar district. This is resulting from we can say, like, for example, let's write together because we already know. This is resulting from low capacity of health workers in okay, this is okay. This results, or I don't know why it keeps doing auto correction. Okay. From the low capacity of workers in IMCI, and no, I feel lazy to write all the sentences. Okay, let me copy paste, and then we will work together on that. I will just do copy paste, and then we do paraphrasing. I'm trying to do this. Maybe it's boring because now we are online. But I want you to know why we are doing the analysis. It's just to write this paragraph. And we will make sure that once we go in the next step to work on the objectives and theory of change, it will become very clear. So let me just try to show you how we do this. Like at least part of it. Has conducted a need assessment and found out that many people are in acute need of health services, especially women and children in Bani Matar district. This is the result of okay, this is because the health service providers no.
Again, we can repeat it because of the poor health services.
Yeah, because yes, of the health services provided due to shortages of tools and equipments that the health service providers could use, okay, need in the health center. Okay, in the health centers. Maybe we cannot see just low capacity. We can see the health workers. We also found out that the health workers need training, training on emergency obstetric care, maybe. Okay.
An ad hoc training, because we are.
Okay.
I guess so.
Okay. Okay. And look. Okay. And then integrated management strategies. There is a lack of incentives and salaries, and incentives and salaries are stopped during the war. Unavailability of health workers was found in many health units and centers, especially midwives and female nurses. Maybe the family planning and counseling, we can add it to the training. So because we talked about it, okay, and okay, to the management of childhood illnesses, and okay, so it's good now.
What about the infrastructure?
Yeah, we should copy paste everything. I will just save this so that we don't lose what we have been doing. We will go back. So we should copy paste everything. If you want, if you don't feel bored, I will continue. Short of medicines. Okay. The health. Okay. The health facilities.
In poor condition.
Infrastructure.
In poor
conditions and need rehabilitation. Okay, need rehabilitation and expansion with shortage of medicines, equipment and basic furniture. Let's go and yes, and see what else we mentioned. Okay, shortage with okay, many health facilities. Okay. Okay. We can see there is a shortage of electricity in many health facilities. What else we mentioned? We mentioned lack of supervision. No.
Okay. Can we say, can we replace supervision intervention?
No, because we talk about the health authorities.
Yeah. The health authorities here, I mean that they didn't do their job well. So maybe at this time, because of the intervention, we need to substitute them. Is it the case, or?
No, we can have for sure. Like everyone would have different idea. It's fine. The most important is that you cover it. Like you don't miss.
The idea that the absence of the role of the authorities didn't do their job for the health services. So the role of the NGO or the proposal just to find a way to substitute the government.
Sometimes we don't need to substitute, but let's say if there is
not fully substitute.
Yeah, like support. I mean support.
Yes, support.
Yes. Yeah. So we can see here let's see low supervision of the quality and continuity of work in health facilities. Okay, we found out that there is a low supervision of the quality and continuity of work in the health facilities by the health authorities due to what I want to say is that there is no operation cost with the health authorities, so they don't have enough money to visit and to do the supervision, especially if they are in very far areas. The lack of financial support to cover their field visits. We can see this. What else did we? Okay. The only thing that we missed is only water services and okay, connected to all health facilities. Sorry, water services are not connected to health facilities, which need which needs to be considered in this project. Okay. So now we covered the other part. As you noticed that we are coming very close from the need assessment. We can also copy paste some phrasing here. People okay. When we okay, our assessment team had a focus group discussion with the targeted community and found out that people lack of we can say that there is a lack of awareness of the importance of antenatal care and safe delivery services and vaccination. And many people are not supporting vaccination of their children. Vaccine, okay, vaccination of their children due to wrong perception about the vaccines. Okay. What else? Because now we show the donor, and also we convince the donor that we need to do awareness sessions. Okay, I think we are good until now. Usually, once we do the need assessment from the community, we bring good data. So when we talk about health facilities, we talk about the numbers and everything. But you notice now that that's how we do the need assessment paragraph. Yesterday, we took that in the context analysis, we talk about like the country in general, about the health sector in general, but we don't talk about Bani Matar, which is the targeted district. But everything we mentioned here was just related to Bani Matar and was very specific related to the service providers that are working in Bani Matar. It was very specific about health facilities in Bani Matar, was very specific about health authorities in Bani Matar. The only thing that is now this need assessment paragraph is missing is that we didn't mention yet at least the results. So this is leading to, so we can see this is leading to all these problems or health, okay, all these
challenges.
Yeah, yes, challenges. Yeah, challenges lead to more suffering of the vulnerable people, especially women and children. Especially women and children due to not receiving adequate health services. They need to save their lives and keep keep suffering from diseases and illnesses. I think we could end up like the paragraph here, and it's really nice. I will stop here so that you could give some questions. I think there must be some questions at this level. No questions?
Just one question.
Yeah.
Yes. Sorry. Here we need to know what was the why we say the supervision of the health of the authority. Sorry. Is it because of the supervision not enough? Because the project itself work because or rely on the community participation, or because here the supervision, or we can say because of the financial aspect or matter that the authorities didn't intervene as should be.
Yes, we mentioned this because, and what we mean by supervision is that we think that health managers in the district, if they have enough budget, they would do a lot of health visits. They can make sure that the quality is improved every time, and they can do a lot of follow-up. Okay. So what we mentioned here, where is it? Let me find it again. Yes, in the health facilities by low supervision and follow up, maybe follow up of the and follow up, low and follow up of the quality and continuity of work. So, for example, there like the health service providers could be absent from the health center for many days, and still the health authority have no idea about it. That is basically what we mean, but you could paraphrase it in different ways. So it's not like something that we should just try. So the idea, Safwan, the idea is that the more you are great in paraphrasing and writing, the more you can bring really good.
Got it. Thank you.
Yes.
So we can say in Finnish and or.
Yeah. You can change whatever, as long as you are trying to explain that point.
Because I missed yesterday, so I'm.
Yeah, it's fine. It's fine.
I'm a bit curious today.
No, that's really great.
Thank you so much.
So hopefully you like while we worked on doing the analysis that way. Now you find it more clear how we converted that analysis to the needs assessment paragraph. Hopefully this is helpful for now. I think we can take 15 minutes break. What do you think for having coffee for those who did, for those of you who didn't have their breakfast yet? So we will give this space, and we come back exactly at 12. We start developing the project objectives, and we work on the how can we develop the theory of change.
Okay, thank you so much.
Okay, so see you in 15 minutes.
Bye.
Bye.
بارد كثير.
Yes, بارد كثير جدا. Okay, so what we will do now, we will just go through the presentation very quickly, like of yesterday, as a kind of like reminder, or for those who didn't participate from the very beginning. I will not take longer, like maybe just 5 minutes to just like a scanning. And then we will move to project objectives and how we can develop the project objectives. We will all do exercises, and all of us will write objectives for their projects. So let me present. Yes, this is the session of yesterday, which is number 3. It's very important that we all have like the same idea before we move to the next point. So when we started in the morning, we were doing practical exercise for the needs assessment and problems analysis in general. We mentioned we identified the problem, then we select the targeted area, then we analyze the problem using problems tree, we collect information, and then we formulate the need assessment paragraph. This was the last thing we did together. As we mentioned, usually we decide who are the affected group and then who are the responsible entities. We did that all together. In education projects, usually the most affected people are boys and girls, and then we have family and community, we have teachers and schools. In our exercise, it was women and children and people, most vulnerable people in general. We talked about community, we talked about health service providers, we talked about health facilities. We select the target areas, identified, it's like a kind of repeated. I will not talk about it because we explained it yesterday, and we will, you can also download the presentation and go through them again. It's just a kind of reminder. So usually the analysis is like we try to imagine a tree, then we talk about the main problem, and the effects are the branches, then the harms are the leaves, and then the impact at the level of the society it's the fruits. And then we have the main roots. They are the responsible entities, and then we have the relevant and direct causes, as we did in the exercise. So we usually use this. We have main problem, responsible entities, causes related, then effect, harms, and impact at the level of the society. And this was for education project, was teachers, schools, and family and community. We talked about the reasons. We talked about the main problem, effects, and harms. As I mentioned, we go to the community, we collect the data by ourselves if we are going to do a need assessment. And we could use secondary data from others reports and need assessment, and we can include in our proposal. So we should not all the time use our need assessment. This is only for OCHA, because OCHA, they are trying to make it very competitive. So they ask every NGO to conduct a new need assessment, just to make it difficult for everyone, but it's not always the case. Usually we can depend on secondary resources or sources. The resources could be like, they could be another, let's say, need assessment done by other NGOs. It could be researches, it could be some documents, some statistics we collect from the health facilities and so on. Then we ask about like every part of the problems tree. We do focus group discussions with communities. We can ask key informant interviews like health authorities or some health service providers, so that once we collect data from them, we can come and try to write the paragraph. So we do it as a description. We did it together, and here we didn't give an example. We already worked together with the example. So we worked on the previous session together, and we make it a paragraph. So I hope it was helpful. I will also just talk about the next paragraph, which is grant request justification. Many donors, they ask about grant request justification, and it's basically they want to know why we really ask for the money, why we are applying to get the like with the budget to get the money. We need to give them an idea. So usually we try to explain in this paragraph to what extent our project is an extension for a previous project, and we think that getting more funding for this project is really important. We should, there could be like a project previously implemented, but there is a missing part of it. So we explain for the donor that this funding is going to respond to some parts that or more improvements in the previous projects. If there is any emergency, for example, what happened in Turkey, unfortunately, this earthquake happened like a sudden emergency. So you might just mention that there is a sudden emergency and you need to respond to it. Sometimes we need to explain why we designed the project this way. This is part of the need assessment paragraph. I hope you could paraphrase it. You could bring good explanations, and as I mentioned, you could work on portal, and then we can give comments. I will stop here for this presentation, so we can go to the project objectives. The project objectives. I will share the presentation, and we mentioned the most important aspects of project objectives. Usually, and everyone knows that project objectives should be SMART, and SMART is abbreviation for specific, measurable, achievable, reliable or relevant or realistic, and then time bound. This is mainly what we mean by SMART objectives. Yes, sometimes some donors ask for general objective and specific objectives. They are still the same. Whether it's general or specific, you need to write SMART objectives. In this training, we will mention that objectives is not only should be SMART. There are also other criteria. So let's agree that we will have 4 objectives criteria. We will have 4 criteria. One of them should be SMART, which is specific, measurable, achievable, relevant, and time. It should start with the words or verbs that show increase or decrease in something. So usually once we write an objective, usually we start with improve, increase, decrease, reduce. We use these words, maybe verbs, and we should answer the question why. So that's why we see in order to improve, in order to increase, in order to decrease, and so on. But usually we remove in order and we keep just to increase, to improve, and to reduce, so on. We use a verb in the present tense. We never use past tense or future tense when we write objectives. So we will not say this project is will improve this and this, or is designed. Usually we say we are developing this project, or we are designing this project to improve this and this. It's like in order to improve. I hope they are clear that like we talk about 4 criteria. I will give you examples and then we start writing objectives for our projects, and we decide and we see to what extent we can write good objectives. So let's see. In the project objectives, as I mentioned, it could be general and specific. When you remember the problems 3, we had the main problem of the final beneficiaries. Let's see, the main problem we mentioned who are the affected group. Then they could be like the general objectives is for the affected group. While the responsible entities, we can develop a specific objective for each responsible entity. So for example, if the main problem was low enrollment of 4,500 children to primary schools in Balanga city during the school year of 2020-2021, the same phrasing, we can just change low enrollment to increase the enrollment. So why do we develop, or why do we want to have this project? We want to have this project to increase, in order to increase the enrollment of 4,500 children to primary schools in Balanga city. Exactly the problem, we just changed the low enrollment to increase the enrollment. And the same thing, like for these responsible entities, we can have 3 objectives for them. So in order to improve the capacity building of, it should be just to improve the capacity, sorry for the word building. So to improve the capacity of 124 teachers in modern teaching methods by the end of 2021. Here we can see to improve the learning environment in 14 schools during the school year, and then to raise awareness of 3,000 parents, and so on. If you see here, we used the word improve, rise. So it's like verbs describing increase in something. And then it's measurable. So we have a number, specific number. Then also, is it achievable? Can we achieve this thing in this project? So far it's achievable. Is it specific? Yes, this is specific for capacity building. This is specific for improving learning environment. This is specific for raising awareness. on, when we mentioned is not just raising awareness and we kept silent. We mentioned on the importance of inclusive education. Also here to increase enrollment enrollment to schools was very clear. And also it's specific because we usually mention the location, and it's all time bound. We mentioned here by the end of the project, which means there is a time. Here we have the time. These are some examples. So to increase, so please just see to what extent we applied the whole criteria. To increase the access of 10,000 children, 5,000 boys and 5,000 girls, to primary schools in Klaipeda County during the school year of 2021. Is it good? Like we used to increase, and then we mentioned the number, so it's measurable. We mentioned 2 primary schools, access to primary schools, so it's specific. In Klaipeda County, so it's more specific, and we have the time, and also it's relevant or realistic. It's relevant to the need, because it's relevant and linked to the problem. Here to improve the capacity of 16 health service providers on integrated management of childhood illnesses in this place, this district during 2021. Here to increase the access of 300 internally displaced people to emergency shelter assistance in the town of Ma'arat al-Nu'man for 20 months, for 12 months. So it's time bound. We use to increase. It responds to why. So why are we doing it? It's in order to increase the access. It's measurable and everything. To increase the access of 700 households in suburban areas of Antakya to livelihoods activities by the end of 2023. To improve the awareness of 1,500 students, the right way to deal with the strange and explosive objects in Aden City by the end of July 2022. These are the way we write the SMART objectives. So we are in the end of the presentation. So let's practice together. It would be very helpful to write the objectives of your project here in the chat, and then we can comment on them. If you want to mention it, then it's fine. So you could write your chat. Everyone could write his or her objective in the chat. You read it, and then we correct it together. To what we will all decide together that it's good or it needs improvement. Who could start? Who wants to start? Who is ready to mention the objective? Let's have good objectives. Okay, I will give you 2 minutes to think about. Okay, now we have because who's using NFDHR Zoom. I don't know who.
Safwan.
Safwan. Okay. Safwan. Okay. So Safwan mentioned that to build capacity of health workers for better performance and rapid response. You all can read it in the chat. So let's say he started with 2 build capacity. So build capacity, it's like describing increasing in something. Also, it responds to is like it started with in order to. So to build is fine. Of health workers, this is not measurable. So we don't know how many health workers. And also for better performance, still not very clear. So performance and rapid response needs more clarification for what. And still we don't know where are the health workers, and it's not time bound. So Safwan, you can improve it and copy paste again. I mean, you and paste it again in the chat. Okay. Safwan, are you added to portal yet?
Sorry, just today.
Okay.
Just today, I created the account and so on. So for me, this is the first time to.
Okay. So just I want to see if you are. Yeah, you are already added. So this is good. Okay. Who else? Yeah, so we have now David. David, objective to improve education opportunity for 500 Ukrainian Romanian high school students by providing laptop, computer, and in 6 rural schools of Bucharest. And okay. Yeah, it's fine, David. Sure, it's not reflecting what we mentioned yesterday, but still we can, it still goes in under the same idea. But let me give you a feedback. To improve education, this is good to start. I mean, used a verb increasing. To improve education opportunity for, okay. To improve education opportunity, okay, for it's measurable. It's 500 Ukrainian Romanian high school students. This is measurable. So now till now is good. By providing, now once you said by providing, you are trying to making it very specific, but also it's like you are mixing. It's like you are mixing like the activity with the objective. So I would prefer maybe to improve. I would say to improve maybe computer education, or to improve the access to ICT services.
Yeah, the classes, the curriculum will change because of the computers. So we're going to be improving, hopefully improving the course material, as well as the second item. I forgot what you just mentioned.
Yeah, we could have like 4 objectives, so it's fine to have many objectives, but yes, at least for this we can make it to improve the access of 500 Ukrainian Romanian high school students to computer education or to computer skills in 6 rural schools of Bucharest and Sud Montania regions. by the end of this or during this, you need to have time.
Yes, it'll be,
Yeah, so you could improve it again, and yeah, you could best it again.
okay.
Okay, so let's see, Najwa, to improve the awareness of 1,000 farmers on the right way to providing animal feed concentrated in Otma district, Damar, Government in 2023. Okay, to improve the awareness of, yes. So to improve the awareness of 1,000 farmers on the right way of providing animal feed concentrated in Otma district in the Mar. Usually when we see in 2023 is good or during 2023, I think it's smart, measurable. To improve is clear, respond to why, very specific because the awareness is especially on the way animal feed concentration.
I don't hear you.
Neither
Yes.
do I. I hear nothing.
All of you, okay. What's going on? Let me see.
Adel, you're breaking out.
We lost you.
How about now?
Guys.
Yeah, it's great.
So now it's good. Okay. I don't know what was going on. Okay. So what I was mentioning is that for Najwa, it's good because it provides a verb of increase something, and it's measurable 1,000 farmers. It's specific because the awareness is specifically on the right way of providing animal feed concentration. It's specific because also mentioning the location, and it's time bound, and it's related to the problem, so it's good. Okay, for Muhammad al-Maghbashi, to improve access of to improve access and delivery of life-saving health services targeting 10,000 households in hard-to-reach areas and affected communities in Bani Matar district, Sana'a Governorate. Okay, it's okay. Let me see. Yeah, so the only thing now is that it's not linked to time, so it's not time bound. To access and deliver of life-saving services targeting hard to reach areas. Yes, it could be mentioned. It could be good. Only the time needs to be added, and only it's specific, measurable, and everything. Or maybe you could just change to like to improve the access of 10,000 households in hard to reach area to life-saving services. In general, it's good, just at the time. Okay, now I think it's Safwan again. To enhance the capacity of 50 health workers in health centers in Bani Matar district for the coming 7 months. Okay. Yeah, so now it's missing enhancing the capacity on what type of capacity that will be improved. So this is this needs more improvement, and also we don't need to see for the coming 4 months. We can see for 7 months, or by the end of 2023.
Okay, clear. Thanks.
Okay, Hayat. Yeah, you can still improve it and boost it again. Okay, Hayat, to increase the access of to increase the access to dignified living conditions for 24 something thousands vulnerable displaced women and adolescent girls in Ma'arib Al-Wadi district through the provision of essential protection services during 2024. Okay, I think it's smart. It's the only thing is that usually when we see by providing or through something, it makes it a little bit mixing two things together. But in general, it's good. In general, it's good to increase the access to dignified living conditions. Maybe you could say to increase the access to dignified living conditions and essential protection services too, so that you don't need to see through, but still is good. I mean, it could be used in the project and it will be considered smart objective. Okay, for Baraka, to capacitate 50 health workers and the integrated management of childhood illnesses by December 2023. Okay, and the integrated management of childhood illnesses. Okay, yeah, this is objective. So to capacitate it could explain to improve the capacity, so it could be a good objective. And specific in integrated management of childhood illnesses, but Baraka, you need maybe you need to mention the location where exactly these health workers are. It's time bound, yeah. So very specific, except for the location. Okay, now I will see for Zainab, I think. Provision, rehabilitation, and maintenance of water supply systems and sanitation for affected people in Sawat Hanash district. Okay, the problem for when we use the word provision, it looks like objective. This is the only thing that you need to consider now. Also, you need to make sure that you mention how many people will benefit, so it's not measurable. So instead of saying for affected people, you need to mention how many people. And also you need to add time. So for Zainab, please improve it and paste it again. Okay. Let me see, did I miss some? Okay. Okay. So I think we have Nader. Yeah, to improve access of, sorry. I lost it. Okay, so if any one of you is also improving the objective, please paste it again so I can read it. Who else is not giving the objective? Okay. Okay, now we have two objectives, new ones. Okay, now we have from Intisar, improving the quality of education through establishment of summer centers to strengthen 500 students in the curricula during summer vacations in Sana'a. Yes. I think you need to be very specific. So, for example, are you mentioning the quality of education in the schools? Because if you mention in the schools, now you mentioned summer centers. You mean summer centers in the schools? So just to make it very clear, it's so instead of improving, it's better to say to improve. You need to mention in how many centers or how many schools you will do this. Although you already mentioned 500 students, and you mentioned that you want the students to get improved in the STEAM curriculum during summer, and then you need to add time. So please try. Sorry for the network. Are you able to copy paste again for those who I didn't read theirs? Maybe you
sorry, just if you can read mine. It is the last one, I guess.
No, yeah.
No, it's up now. So I'll copy paste.
It's not just up because I had lost the network, the internet, so I missed all the objectives you copied and pasted. Okay, now I have only David.
Read mine first.
Okay, I will start with David. Okay, so David said to improve access to computer education and increase IT capacities of 500 Ukrainian and Romanian high school students in 6 rural schools of Bucharest and sub-regions from summer 2023 to March 2024. Maybe you just, yeah, so until you mentioned the time, it's enough. So you don't need to see by this and this and this. You don't need that, because it will be clear in the activities. Okay. And also for the time, it would be much better if you say by the end of 2020. No, you could
end
say
of school year.
Yeah, during the school year of this, or you can say for 9 months, and
yes.
And yeah, it would be much easier. But it's good, like from the very beginning until you said by, then we just don't need by. Very nice. Okay, now Safwan, to provide. By the way, to provide, usually provide is the verb that reflects activity, not objective. So please, we can remove provide and say to increase the capacity of, or to improve something. Why we need to change to provide? Because provide it reflects activity, and it doesn't respond to why, it responds to what. So it's like I'm asking, what are you going to do? You see, I will go to provide, or I will provide this. So it's activity. But the objective, I see why do you want to do this? So you see, I do this to improve or to decrease. So it's totally different.
Okay, I said here to provide to first aid trainings. Is it okay, this word?
Okay, to provide. So we decide, we agreed on the verb. Then to first aid trainings. Okay, to enhance. See, now you started to mention the objective.
Okay.
To enhance the capacity of 15 or 50 health workers in 2 health centers in first aid. In first aid.
Okay.
At Bani Matar district, Sana'a Governorate, for not for the last, it should be in the future. So for 7 months. Okay. Okay. You mentioned in the last 7 months of 2023. It's fine, but please don't use last.
Okay. So thanks. Thank you so much.
You could see just by the end of 2023. It means 7 months from now.
Okay. Okay.
I think now, yeah, now you are very close. Okay, Nader, to improve access of most affected family ITBs hosts by war in the Mar and Al Bayda Governorate 2023. Yes, now you need to make it, you need to have the number, so you make it measurable. And also you didn't mention
the kind of the assistant, yes?
Yeah, and you didn't mention what type of assistance.
Yes, I noticed that now.
Okay. Najwa, to improve the access to high quality feeds through distributing feed concentrates. I think, Najwa, the first one was much better than this. But if you want to mention, the first one was about awareness, then now you are having the other objective. So to improve the access to high quality feeds through distributing feed concentrates and mineral blocks for 10 farmers in Otma. Okay. It's very tricky here. Let me think about it. Because, you know, the access is not the best word for this type of assistance. I think we need to think about it again.
It's fine, doctor. You can take your time. I'm just trying to know more than one objectives, you know.
Yeah, but because, you know, when we mention farmers, and then we mentioned access, and the feeding is not for the farmers, it's for the animals. That's why it's very tricky.
Okay, got you. But in general, all the principles that we have mentioned, I need to apply them in either.
In all the objectives. Yes.
Objective. Okay.
Yeah, but for this specific objective, because the feeding is for animals, so we need to think about it. Like you need to think about the access and the 1,000 farmers.
Okay, I will try to paraphrase it and send it again.
Yes, okay, it would be good. Hayat, okay, to increase the access to essential protection services for 24 vulnerable displaced women and adults and girls in Ma'arib al-Wadi during 20. Yes, now is good. You could also do very slight change, which is to increase the access of, you can see, you increase the to increase the access of 24,000 vulnerable displaced women and adults and girls to essential protection services. You could do this change. So the access of number of you mentioned everything, and to essential protection services would be much better. But still you can use it, like still you can use it this way. Okay, Zainab, to rehabilitate. Again, to rehabilitate is like a verb, is like objective. So please use to increase, to improve, to decrease. Okay, to maintenance of water supply systems and sanitation for 2,000 affected people. Now it's measurable. Location is mentioned through the provision. No need through the provision of service, because it doesn't mean anything. But you can see to improve. You can see to improve the access of 2,000 affected people in Sawat Hanash district to safe or to clean drinking water by this and this, because the activity, the objective is not to rehabilitate. Like why we will rehabilitate, it's to improve the access to water, to clean drinking water. Or maybe you can see to improve the water supply systems. You can see this, to improve the water supply systems and sanitation services for 2,000 affected people in Sawat Hanash district during 2023 would be good. Zainab, do you hear me? Can you do the change?
Yes, doctor. I will do.
Okay. Okay, Dr. Abdurrahman, the primary objective, is to improve, to improve community satisfaction by 25% water sanitation waste services provided by the local authority in 5 districts in Sana'a Governorate, 6-month collaboration with 3 CSOs. Yes, so I think through collaboration, collaboration, in collaboration with 3 CSOs, you don't need that. You don't need to mention the collaboration of CSOs. And also, okay, to improve community service satisfaction by 25%, water sanitation waste services, 5 districts in Sana'a. It's good, but only remove collaboration with 3 CSOs. The last part, you don't need it. And also you could change through 6 months. You could say in 6 months, or maybe you can say by the end of 2023. In general, it's measurable because you mentioned it's 25% increase. And also it's specific because it's community satisfaction. Usually this type of objectives is very difficult because it has a percentage. Usually I advise everyone not to use the percentage because it's difficult to measure, and also it needs more time. So 6 months is not enough. Okay. So in order to improve access of of the most affected family IDPs and host by the war, if you can see the access of 12,000 of the most affected, and then okay, through provision of monthly unconditional emergency food assistance in the MAR Al-Baida governorates during 2023. So please add during 2023. In general is good. In general, now is it could be used this way, is good. But if you see to improve the access of, and then you have the number of 12,000 most from the most affected family IDPs and hosts by war. You don't need to see through provision. You can see 2 monthly unconditional cash assistance. Okay, now is good, but in general is good. I'm just trying to improve it to make it perfect, but it's still really good. Okay, Najwa, to improve access of 1,000 farmers, to improve access of 1,000 farmers to high quality feeds, to high feeds concentrates and minerals blocks in Otma Damar. Yes, I think for Najwa now is very good, but still I'm curious to do some change because of because to what extent it's really reflecting 1,000 farmers, because the quality, high quality feeds concentrates is not for the farmers themselves, it's for the animals. I mean, it's just the meaning tricky here. So I think we need to think about it again. How can we make the objective reflecting that the improvement of their animals feeding, or think about it. Okay, in order to improve access of, yes, to 12,000 households of the most affected family by war, I think just remove to provision of, just remove provision of, because it will be, yes, by war, 2 monthly unconditional emergency. It would be much better, but it's really good. It's really good now. Yes, we have really good objectives so far. Okay, to improve access of okay, now is perfect. To improve the access of to 12,000 households, the most affected family IDPs and host by war, 2 monthly unconditional emergency food assistance in the MAR and Al-Baida governorates during 2023. Now is very perfect. So great, Nader. Now we have great objectives by everyone. Who else? Bashir, can you share with us an objective? Who else is here? So maybe Safwan, you can change your name in the Zoom so we can read your name. Adam, if you can share some objective. Okay, now we have Zainab mentioning to improve water supply systems and sanitation for 20,000 affected people in Sawat Hanish district in 2023. Zainab now is good. Now is really good. This is great. Okay, now Bashir, to improve support for children to access education through the rehabilitation of 9 schools in Bani Ghais district, Hajja Gavin rate. Okay, I think you only time, you need to mention the time at the end of the objective. So when are you going to do it? Okay, so to improve the support for also, okay, you mentioned 9 schools, which is measurable. But if you could mention how many children will get the support, so you can mention the number of the children and also the time at the end of the objective. Great.
Sorry, Doctor.
Yes.
This is Nader.
Yes,
If I have a specific districts in Damar and specific districts in Ubaida, should I specify them in my objective?
If it's just like one objective, sorry, one district or 2 districts, so the objective will not be very like complicated. But if it's not just 1 or 2 districts, you don't need to. Just mention it like this is good.
Okay, thanks.
You are welcome. Okay, now is good. Who else? Any more objectives? You know, especially the objectives needs a lot of practices. That's why it's fine to take time. It's totally fine. Maram, just are you just joining us now?
Yes.
Okay,
I just come back from the ministry. I'm sorry for being late.
Okay, so I don't need to wait for your objectives. So you can just follow wherever we are. It's fine. Okay, so
I
what?
have a question, Dr. Adel.
Yes, sure.
I'm wondering about the length of the sentence of the objectives. Should it be that short comparing with the title of the project, or it's fine, just make it clear as necessary as it is regarding if it is short or less or long?
It should be smart and with all the criteria. It's fine to have it long, but not very long, to the point that the reader will not be able to figure out like the logic of the sentences. That's one thing. But as I mentioned, for the names of the project, please forget about the way we write projects for OCHA. Usually these are the worst names of projects I have ever seen, is the projects of emergency health services provided. And so it's like the push for very long names of the projects, but it doesn't mean that what the names of the projects are the right thing. Usually the name of the project should be very attractive. It should be very clear. I remember in 2014, we developed a project that was mainly providing 12 awareness messages, and we decided to implement it in 12 districts, and in each 12 districts we will target 12 young men and 12 young women to train them, and everyone will conduct 12 awareness sessions in 12 months. So it was all 12. So we named the project Your Life in 12. So I remember when I met the donor, I told the donor our project will be Your Life in 12, and it will be designed this way. It will be 12 in everything. And the donor was really he liked this. I mean, he felt, he felt like it was a joke, but because he was I mean, it was UNICEF, by the way. They had a guideline for 50 awareness messages. I told them, of course, we cannot use the 50 awareness messages, so I will select 12 messages that are really relevant. So, for example, one for the importance of education, one for the, let's say, breastfeeding, one for cleaning, what can we say, like hand washing, one for health. So it's like 12 for the main health messages, or 12 of the main awareness messages that UNICEF is supporting. Because we named the project Your Life in 12, and everything was 12, the donor likes it. Why I mentioned this, I'm trying to encourage you to use very attractive names for your projects. And please make the names of the projects as short as possible and as attractive as possible, but also it should be reflecting what inside the project. Okay. Do we have more objectives? No, no more objectives. Any questions before we move from this part? We have Adam. I think I didn't hear from Adam if he has any objective to share. Okay. Also, we have Zainab. If you could change your name in the Zoom, so anyone can read your name and know who you are. Noura, do you want to share any objective? I mean,
I think Noura today has a problem with her microphone, so she cannot.
Okay.
Yeah.
Okay. Okay. No problem at all. Okay. So what I want now is that you all added your proposals to portal. So you go to proposals again. Everyone, or for those who already added their proposals, you could, oh my God, this is really, really old, I mean, a very long name. So please, Dr. Abdurrahman, if you could make it very short. I think you could make it just the first part, community partnership and accountability project. This is really good. You don't need to make all the other part. It would be much better to remove this part. Because this will help us a lot to enjoy even reading the project. So please make it very short. Okay, let's go. For example, now Muhammad can come to his project like this. You go to logical framework. You can add. Okay, you are already working on that. For sure, once you have some objectives here, you can just add one of them and add 100%, or add the three and divide to what extent this objective is feeding into the strategic objective of the organization, for example. But here you can come to project objectives. You can add the objectives here. So please, you can copy paste your objectives and add to your project. I can comment here on to improve the access and delivery of life-saving health services, targeting in hard-to-reach areas, affected communities, Bani Matar district, in Sana'a Government Race. Just here, you can make it by the end of 2023. it would be much clear. So by the end of 2023. Okay. So now is good. Nice. So how many of you already added the proposals? We have only 7 proposals, so please continue working on them. For David, I think you need to change the name of the proposed of the project too. Then you go to logical framework, and please add project objectives. Maybe the same objective we discussed, you can add it here. Okay. Okay. Should we have a break for 1 minute just for you to breathe?
Okay, Dr. Adil.
Yes.
Just one question before the break.
Yes.
Assuming that I'm choosing the name of my project, I'm planning to focus on the districts above the mountains or at the top of the mountains of Al Mahwid.
Can you mention it again?
There's a place, its name Kabul Milhan, something like this in Al Mahwid.
Okay. Okay.
Yes, and that district, it's always like hard for students to move from a school to other because of the really huge heights there. So, like for example, can I, for example, just saying, to name my project like education above the clouds or education at the top or something like this, like without being so precise of what I'm going to present in my project?
If you want to name the project, usually making it short, and also try to make it as close as objective as possible. Like for example, if your project is to improve education services for 12,000 students in Milhan Al Mahwid.
Yeah.
Yeah. So you can see the improve access to education in Milhan project. You can see like that, or in Milhan district, and that's it. You can have it as short as possible. Improve access to education services in Milhan district project. That's it.
Okay. Clear enough. I will send you the name of the project later on the chat to have a look at of it.
Are you able to add a new proposal in portal?
No, not yet. There's a problem in my computer. I will fix
okay.
it later.
Okay, no problem. That's fine.
Okay, thank you.
Dr. Adel?
Yes.
So I have heard that you were asking if she can add it to the proposal in the portal. Should I do the same on my side?
Yeah, everyone. This is applicable for everyone, please.
Thank you.
Okay. Yes. So now we have a question from David. So if we go to so if we go to the proposal, and then you add logical framework, you click logical framework, and then you have project objectives. So not the strategic objectives, it will be the project objectives. You can add a new and copy paste yours.
Thank you.
I will ask you for just 1 minute break so that everyone have like maybe a cup of coffee or tea or whatever, and come back, because we will start working on we will start developing a theory of change. So I need you to come like very refreshed. Okay, so now I think hopefully you are already back. Please raise your hands if you are back. I want to make sure that you are already here.
We are back.
I'm around too.
Okay, so I think I'm ready. Hopefully everyone is back too. Okay. Okay, I will talk about the theory of change and how can we develop the theory of change. Yes, Nora, you can ask before we go on. Nora, you have a question? Yeah, I think Nora was just raising her hands because I asked everyone to me
Yes.
to confirm they are here. Yeah, sorry, Nora.
Yes.
Okay. So the theory of change is something that is considered really difficult for everyone. And why we think it's difficult or maybe not clear, because we don't do the problem analysis in the right way. So if we are really understanding how to do problem analysis, I'm sure you can do the best theory of change. So let's see how can we create our theory of change. So in this session, we will do we will clarify what is the theory of change, and we want to mention what is the difference between logical framework and theory of change, because for many organizations and donors, the theory of change is the logical framework, and for many others, they want both. They ask you for a theory of change, and then they ask you for a logical framework. Why they could ask for both if it's the same? So for sure there is some differences. I will start by just reminding you with the problems tree. So this is the problems tree analysis for a water project. The same thing we just mentioned like earlier today, very fast. And then, of course, yesterday we talked about it. The same problems tree is reflected. So for example, we had the affected people will be outcome. So the affected people, they will become now in the theory of change, they will become final beneficiaries. The responsible entity number one will become output one. The second responsible entity will become output two, and the third will be output three. So the theory of change is exactly reflecting the problems. So the problems tree, when we reflecting it like positively, it will become the theory of change. We can see it like this: the main problem of the affected people, it will become the general objective. The first responsible entity will be, we can make it like first specific objective. Same like for responsible entities here, we can make it like objectives. And then the effects in first entity will become 1, 2, 3. So effects will become outputs. The harms of the final beneficiaries will become outcomes. So we have harms, now we have outcomes, or sometimes we say results. Impact on society is impact on society, but this was a negative impact, and here it's already positive impact. Any cause, any direct or relevant cause is going to become activity. So we have activity one, instead like the cause one will become activity one, and so on. Cause 2.2 will become activity 2.2. This is just in general before we go to practice. As you can see here, like that previously this effect was 124 teachers in the targeted areas have low, like they don't use interactive teaching methods. But now it becomes different. It becomes they are capable to provide, or they have the capacity to provide. Now the schools becoming providing child-friendly environment. For the fathers, or let's say the parents, and fathers and mothers, now they had awareness sessions, and now they are supporting their children's education, and so on. There were no enough classrooms, we will build classrooms. There were no student desks and furniture, we will purchase new ones and repair the old ones, and so on. So it's like we meet the negative things to actions that reflect the solution. The families were not able to provide stationery and support their children in schools, so we will distribute school bags. There were no advocates in the community, so what we did is that we established community education committees, and then we will train them to support education in the community. Teachers were using violence for children, like they used violence and verbal violence. And now what we will do is that we will train these teachers on how to provide psychosocial support for the children. So instead of violating or using violent practices against the children in the schools, they will become psychosocial support providers, because they will get trained, they will understand the impact, the negative impact of using violence. Then they will become much better, and they will also support the children after that. There were no incentives or salaries, then we could, for example, bring incentives and for teachers. There were no toolkits and tools for the teachers. We will distribute school in a box kits for teachers and so on. When you see this, if you see this, I can see it's a theory of change. Of course, it's really good, but how donors are really using the theory of change? Usually it's like this. This is the easiest form of theory of change. So usually the problem, they explain the sentence like the mean problem. We have it here. So we start with the problem as summarized as possible. Then we have inputs. You could have many inputs. So for example, all of these, they could be inputs. For example, we see recruitment of teachers, provide incentives, training of teachers on psychosocial support, distribution of school in a box kits. So these are all inputs. And here we can see build new classrooms, repair old desks, purchase new desks. So they could all be inputs. But here we are just bringing, making it very short. So we mentioned input, train teachers. We didn't mention everything, but it's just like an example. Here we said renovate schools. Renovate means rehabilitate, improve, provide anything that is needed. And here we see rise community awareness. These are inputs, like very summarized. And then you notice that if we raise community, if we raise the community awareness, then we will have supportive community. This is the output. If we renovated schools, then we have child-friendly schools. So now, this is the output. If we train teachers, we will have qualified teachers. This is the output. You can see here that if the teachers is becoming qualified, this looks like a result. Yes, it is a result, but it's not for the children, because why we designed the project, it's for the children, for boys and girls. So the project is for these people. It's not for the teachers. So if the teachers have improved capacity, it doesn't mean that we already have an outcome. No, this is not outcome. It's still output, as long as it's just for the responsible entity. So at this level, whatever the change is, it is still for the responsible entities, and it's just for the outputs. For example, fathers and mothers, they were not aware. Now they become aware. So this is a change, but still it's the awareness the awareness is for the fathers and mothers, but doesn't mean that we already changed the situation and that these children are going to school. Once they go to school and they go to school that provides high quality service by qualified teachers, and we have a supportive community that brings everyone that drop out, we end in having a good outcome or the best outcome. So now the boys and girls have improved access to primary and secondary school. And the impact will be positively mentioned here. Before it was illiteracy or literacy decreased. Now it's illiteracy, which means we can change this. We can change this to literacy improved. So it's like people in the community, or all the community, are able to read, and they are able to continue their education, and they can become something in the future. This is the theory of change in general. What is the difference? Is it already a logical framework? Yes, but not enough. So usually, in order to make the theory of change as a logical framework, we will have to add indicators, and we will have to add the targets of the indicators. We will have to add verification methods, and sometimes we need to add assumptions and risks, or maybe it's just risks and mitigation measures. So it's like this. This is the logical framework. We will have the impact statement. Then we add the indicators, target, and verification. Outcome indicators, target, verification, and risks. Usually you could ask why we don't have risks analysis for impact. Usually because the impact is in the future after the end of the project. The donors do not ask for a risks analysis for the impact. Activities, same, we have activities, activity indicators, target, verification methods, and assumptions and risks. So this is the difference. The theory of change is just in this colored column, while the logical framework, you have all these. Hopefully it's clear now. We will practice, of course, so that we make it very clear. Now we have, before I move, I will just comment on Maram. She mentioned the name of the project, Improving School Infrastructure to Facilitate Children Access to an Integrated Learning Environment, Giblat Milhan Al Mahweed 2023. This is objective. Maram, can you comment? Is this an objective or the name of the project?
The name of the project.
It looks like an objective, like very clear, like exactly like objective. So you could make it, okay. You could make it very short. And what we need to know is that maybe you can see just improve access to education, or maybe you can see improve the access to high quality education in Giblat Al Mahweed or Giblat Milhan. That's it. You can just make it like this.
Okay, I was just wondering, like when someone wants to be a creative while naming the project, like this is the usual, like access to high quality.
Yeah.
This word, like we want to change this word.
If you want to make it,
this is not attractive anymore. I feel like. I don't know, my opinion.
You know, in order to be creative, sometimes you need to really feel the project. Like for example, you in 2012, this is before 11 years, we were in Aden. So we were in Aden city, and we were doing assessment, need assessment for the IDPs, the internally displaced people, who were from Abyan, and then they were displaced to Aden. Then they were all in the schools of Aden. During the beginning of the school year of 2012, both the students in Aden were not able to go to schools because it's filled with IDPs, and the children of Abyan IDPs are not able to go to school because they cannot go back to Abyan. So when we were doing the meeting, I noticed that the students in Aden, they were crying because they want to start learning, and the same for the student, like the children of Abyan. They were both feeling really sorry because they lost 1 year without any education, and the school year has started, and that's why at that time I felt like how much they are missing the school. So we created the I Miss My School campaign. This was the result of this, because we felt it.
We look for,
Yeah, I mean, because sometimes you really think about it differently, or you really feel it. And also, sometimes I think Ahlam explained it yesterday, or Olga, I don't know who else. I didn't watch the recording yet. But I mean, we mentioned there was an education project that was implemented in I think Somalia by 4 different agencies, and they named the project the Education is Light project. So it's exactly the translated the Arabic proverb, which is al-ilm nur. Mashru' al-ilm nur. It's very clear. So now you can, yeah, so you, when you see this project, still mentions that it's education. Aisha?
Yes.
Maybe it was just the mic. Okay, sorry. Yeah, so I mean, the most important when you have the name of the project is that it's still mention the sector. So when they say education is light project, very short, 4 words, still they mentioned that it's education project.
Yes.
And when we said that I miss my school campaign, it's still education project. So it's not going to, like, no one will think, is this education project or it's a food security project? No one will think about it.
Yeah.
So yeah, you can be creative, just you need to think about it differently. But what happened now is that we see how donors are pushing, especially OCHA. I'm telling about them because we have been writing a lot of proposals to the point that we feel bored to create new names. So we just have the same names. We have like very long name, and when you write the report, you feel like the name of the project is already a report. Like just the name of the project.
Yes,
Very
yes,
boring.
Okay. Okay, thank you, Mr. Adel.
I will also ask you something. I mean, I ask everyone, not just you, madam. If I ask anyone to remember a project, you cannot, because they are all have long names. So once you try to think about, if you are talking about the project, you need to say, do you remember the project of to increase the access of yeah. I already lost the interest.
The words are the same. Like, for example, in education, we have 5 projects. And actually, to be honest, I cannot remember like one whole name project. Like, and I'm sure that this is in Beit al-Faqih, education, access, and stuff like this, because they're all the same. Like the same words: access, education, quality of education, and Beit al-Faqih, Beit al-Faqih, Beit al-Faqih. Just like this, I mean.
Yeah.
But I miss my school. We can never forget. I miss my school campaign. I read about it like it was before how many years, but it's stuck in the mind. This is what we wanted to be in the name of the project.
Yeah, and also I remember in 2015 we had a project called Emergency Health Services Project 2015. It was a good name for health projects. So in 2016 we mentioned the same. We said Emergency Health Services 2016. Emergency Health Services 2017.
2017, yeah.
But still we remember it. So it's very helpful. I think this is for all of you. Please think again about the names of the projects. Yes. So now we will do a practice for the theory of change. Let's develop a theory of change for the problems that we lost the David project. We need to rewrite it again. Maybe Olga, if she is here. Olga is not with us. Maybe I will ask Olga. Yeah, you are with us. I didn't. Yes, maybe if possible, maybe you could review the recording and rewrite the problem analysis of David's project.
Okay.
Because we don't have time to do it again, so that we can develop.
Sure, I will do that.
Yes, thank you, Olga. And also you could still be with us. It's just like maybe even not now, maybe after the training. What we will do now is that we will use the same problem analysis for the health services project that we did the analysis for, so that we could benefit from the time remaining. How long do we still have? We still have just 1 hour and a half. Are you expecting to have a lunch break?
No.
No. Just keep going. Keep on place.
David, did you say yes in Arabic or you said no?
It doesn't matter to me.
Okay. So what I will do is that maybe for anyone who is hungry, you could ask for a sandwich and eat while you are with us. And I will share the Excel sheet, and let's work on developing a theory of change, and hopefully it will be, you can apply this in your proposals. We should have more time for all of you, and we should go like we should review all your theory of changes. We should do that. So let's start with the one we have. Where is the Excel sheet? Okay, let me share it. Hopefully it's not a boring, I mean, once we share the Excel sheet, and hopefully it really keeps you with us, not busy with different things, because you know online training is really tricky.
No, it's fine. We are interested that you are suffering, typing and so on.
No,
So
like, I usually do it just once, and everyone should present his proposal, and he fix while we watch. But now it's okay to do it alone for now. Yeah. So now, usually the theory of change, we can name it like a solution tree. So we had a problems tree. Now we will have solution tree. So we will start like this, and I will show you how to make a theory of change this way, and maybe we can also try to make it like exactly as donors want. So I will start by copy paste everything we have here. Okay. Hopefully it's it will be okay. Great. So we started just copy paste whatever we had, and then we will work on that. Is it clear for all of you, or I can increase the size a little bit? Okay, now it's much clearer. Yeah. So as we all agreed that the main problem, we will make it general objective. And then the responsible entities, we can create specific objective for each one. Here we will keep the general objective for the people, the most affected people. Okay, we agreed on this. So what we will do is that we will see that increase the access. So we will make it to increase the access of, let's say, I will just use a number. I'm not sure about it, but to increase the access of 10,000 people, 10,000 of the most vulnerable people, and then okay, of the most vulnerable people, especially women and children. If I want to see this, and Bani Madar districts to emergency life-saving health services. Sometimes we can see life-saving health, or we can see maternal health services. If we want, we can see maternal health or child and maternal health services, depending on what we really want to do by the end of, or we can see for 12 months. I think Safwan was asking. Safwan, yes. Safwan, you had a question?
Yeah, yes. For once we mentioned the access of 10,000, shall we genderize female and female, or just?
Yes, it would be much better to have like separate figures, so we can see
Okay.
2000s. Then we have in brackets. We can divide.
Okay.
We will have one session exactly to just comment on these things. So,
Okay,
yes.
thank you.
Yes, thank you. So we have one session called gender inclusion. We will have to discuss everything related to the numbers, figures, and how can we improve the gender inclusion in the proposal. Sorry for this. Just okay. I think what I will do is that I will decrease. I will. Now it's good. So are you? Do you all agree that now we have smart objective to increase the access of 10,000 to most vulnerable people, especially women and children, and Bani Matar districts to emergency life-saving? I think we don't need to have child, and because it becomes really long name or long objective for 12 months, or I can see by the end of something. Okay. And here we can see to improve the capacity of maybe, let's say, I don't know how many are they, but maybe 24 health service providers and IMCI and EMOC by the end of the project. I didn't mention the location in Bani Matar.
So sorry, EMOC, what it stands for?
It's we mentioned it here. It's let me show you. It's emergency obstetric care. And in Arabic, I would mention it in Arabic. It's الرعاية التوليدية الطارئة. Okay. So now we have smart objective to improve the capacity of 24 health service providers in Bani Matar district. We can see in or on, sometimes it depends on IMCI and EMOC by the end of the project. Please correct me if you find something that is not clear or something that needs to be changed. Okay. Here we have to improve the quality of health services and let's say 10 health facilities Bani Matar district by the end of 2024. For example, depending on when I mention the number here at the time, it means it should be the same end time of the project. Okay, for the community, we can say increase awareness, or to improve, maybe the best, to improve and awareness and acceptance of maybe we can see acceptance of family, maybe reproductive health and vaccination services by the community in Bani Matar during or let's say by the end of the project. Is it a good objective? Who can comment? Any comment? Please tell me you see something wrong.
Can we specify the awareness here? Awareness, or this is not the time?
In terms of specific, like the topic, it's very clear. It's related to reproductive health and vaccination services, because usually now the community is rejecting, refusing, for example, refusing family planning or refusing that their children get vaccinated. It's clear. I mean, it's very specific. But there is another problem.
The time frame, I guess, the time and the number of.
The time is good. The time is fine.
By the end of, yes.
Okay.
The number of beneficiaries, or?
Yeah, so it's not measurable.
Yes.
How can you know that I achieved this? What are you going to measure?
So we will see the before conducting or carry out the project. We see the number of the ones who used to come to this health facility. Then we see how many that benefited from.
No, but it's fine, Safwan. You can decide the number and then you put a budget for, because it's just awareness. You can decide the number and then you go and conduct the awareness sessions. But we don't know how many people will participate. I didn't mention that. And then I might just conduct one awareness session for 20 people, and then you can't see that I didn't work. That's the idea, because I didn't mention and it's not measured. So maybe here we can see the awareness of, let's see, 5,000 people. On maybe we can see on the importance, if this is on the importance of reproductive health and vaccination services for women and children life. For okay, maybe we can buy. Okay, no need for the community. And also here, we can take this. We make it here. So the awareness of 5,000 people in Bani Matar on the importance of reproductive health and vaccination services for women and children by the end of the project. We are good now. So I will. Okay. I hope it was clear. Okay, now what we will do is that we need to make everything here, every problem, we need to make it activity or input. So for example, we will start in the middle. We have the shortage of medicines. So what we will do here, so we can see provide three medicines, three essential, we can see essential medicines to the targeted health centers on monthly basis. I don't know if it's pieces like this. No. Is it like this? Or?
Yes, it is. Yes.
I
no. It is I. It is I.
Okay.
Yeah.
Okay. So now we solved this. How about this? Okay. Provide equipment for the health. Okay. That is needed in the targeted health facilities. Of course, we can make it very specific. For example, if we know exactly what are the equipment, if it's the same equipment in health facilities, for example, provide or install X-ray in 2 health facilities or 1 health center or 1 hospital, it would be much better than just mention it like this. Okay. Poor conditions in health facilities that need rehabilitation and expansion. So we can say renovate or rehabilitate. Renovate. It would be much better if we know exactly how many health centers or facilities. But because I mentioned 10 in the objective, I'm just adding 10 here. 10 health facilities in any matter. Okay. Water services is not connected to the health facilities. We can say
fixing or
maybe fix, but now maybe
piping water.
Yes, I don't know how to, but we can see. Is there any wash expert? we can see that.
Connecting water service. Can just we say connecting water services
Yes.
to all health?
Yes, connecting or connect. If you notice here, when I use I see provide, it would be very clear. It's like provide, renovate, connect. Connect, maybe if we did the need assessment, we know it's just 2, for example, connect to health facilities to nearby water resources. I'm not satisfied very much, but could go. Okay. Shortage of electricity in many facilities. We can see here provide, install. Sometimes we can say install solar systems and 10 health facilities for ensuring electricity. Or we don't need to do that. We can see just like this. Okay, at this level. Usually, once you write activities, you could explain a lot. But because now we are in the theory of change, the short it is, the more it's better. I mean, we try to make it very short. Okay, solar systems is done. What else? Shortage of basic furniture. Provide basic furniture for 10 health facilities. Okay, low supervision. We can see provide maybe can we see monthly how can we provide cash for health authorities so that they do the field visits?
Yeah, cover financial matter or the deficiency. Yes, or some.
The health authorities
with financial
and Bani Matter district
with
support to cover
the expenses.
Expenses for supervision and follow up. And
can we say for better supervision?
Yes, for better supervision, follow up of supervision of the health facilities, we can see. Of the quality and continuity of organizations. Okay, I think we can see this.
No, can we say for better performance? It's much better than supervision. For better performance. No, better performance. Okay.
Or we can say for supervision and follow up of the quality and continuity of work and health facilities during, we can say during the lifetime of the project, at least. Okay. As I mentioned, it's all everything is. I mean, everyone can change anything based on how much he's perfect in English and the way he could do the paraphrasing and writing.
Yeah.
Okay, now we have health facilities are very far. If there are many areas where the health services could not be provided to them because they are very far, and then you cannot build a new health unit or facilities, what you will do is that you could conduct or support maybe I don't know if we can say operate.
We may conduct outreach activities to the far areas or remote areas.
Yes, conduct outreach activities targeting the remote villages. With or at least with sorry, I forgot with vaccination.
Okay, can we say? Okay.
We may include all the package that is provided in the health facility. We may include it in the outreach.
Mobile clinics. Can we say mobile clinics?
Yeah, that is another
way. Like a mobile clinic, but the mobile clinic is operating on a daily basis. The outreach activity is weekly or monthly basis.
Yes.
Okay.
Yes. I was thinking about the mobile clinic when I started writing here, but outreach activities sometimes it's easier and less.
Okay.
I mean, you need less expenses.
Okay.
Because I think the outreach you will go with your with the same team in the health facilities.
Yeah.
While the mobile teams needs like a dedicated team.
Separate team.
Yes. Okay. So now we did a lot of things for okay. We mentioned a lot of points in this project. Okay. So let's continue working on the other parts. We had a low capacity for integrated management. We will do conduct a training for 24 health service provider and integrated management of childhood services. So we are good. The same for okay, provide monthly incentives for, I don't know how many staff, but let's say 24 health professionals or providers, okay, in Panama, and availability of health workers in many health units, especially midwives and female nurses. What should we do here? Sometimes we recruit, we bring staff from different areas, like we hire new staff and we contract with them to work in the targeted district. Sometimes we could go back to the idea of the mobile clinic. So it goes around this the targeted district to cover the areas where no health facilities are available. What is the best thing we should do here? Should we do anything or we can just leave it?
Is it easier to provide visiting nurses and midwives or a mobile clinic?
The mobile clinic is much easier. Still, sometimes we don't bring mobile teams, but we hire some professionals. For example, we could hire a surgeon to work on the main hospital of the district if it's ready to provide surgeries, but no staff, for example. Or sometimes we could just hire 2 medical doctors to work in the 2 main health facilities, or into 2 main health facilities for maybe for the project is for 12 months, then it's the same. If there are no midwives, then we can see hire 2 medical doctors and 2 midwives. It depends like on the numbers, on the need assessment, where is the need and what type of need is or support is needed and so on. So what we do now is that we are assuming, and then if we are doing a need assessment, if we ask, then we can change the figures and numbers and everything. Low capacity in this, we can see as you can see here, we don't see improved capacity. We don't see improved capacity because it seems like objective and it doesn't mention what we will do. So the best way in the activities is that we do conduct. Maybe we can say conduct 1 capacity, conduct a training, or one capacity development. This is not the best. Conduct a training for for, let's say, 10 midwives. There might be midwives, or 10 or 12 midwives and female doctors on emergency obstetric care, EMOC. Okay. Low capacity in reproductive health and family planning. Here we can see counseling, also conduct a training for, let's say, 12 nurses on reproductive health and family planning counseling. I don't know it's on or end. No worries about grammar here, so please. So okay, we will just focus on the main content. Okay, I think we covered all the parts. So what should we do on this? It was lack of awareness of the services provided in the health facilities. What is the best thing we do here? Maybe what the best thing here is that
conducting awareness session.
Yeah, it could be a session, but maybe because we need people to read about the services, maybe design a brochure, maybe design a brochure that has information about the type of services provided in the health facilities and how to maybe it's just enough. No need to explain. Okay.
Doctor, maybe TV in waiting room.
Yeah, TV, yes, sometimes a TV, and yeah, we this could be part of providing equipment. We could make sure that it's part of the equipment or the furniture.
Yes.
Yeah, but yeah, that is another idea.
I mean, it is the same with the brochure.
Yes, we can make it even another activity here. Record, but you know the problem is that the TV. Okay, we will have. I mean, should we like develop a short video and then we do it on like for each health facility? So
I mean, beside beside the brochures.
Yes. And okay, design and print. Let me see it and print. Okay, design, print, and distribute. Brochure. We can see even, let's say, 10,000 brochures that has information. Okay. It needs like a different activity, like the one you mentioned, Nader. In general, yeah, the idea is good. Lack of awareness, we can see awareness sessions.
Here we may conduct awareness sessions to the local community.
Yes. For how many did we mention above? 5,000 people. Okay. For 5,000 people on the importance of antenatal care. The same here we can repeat, and we can have just one single activity. We can have one single activity and vaccination and vaccinations. Services of vaccination. And vaccination services. Yes. The importance of antenatal care, safe delivery services, and vaccinations. I was trying to figure out what happened. Sorry for that. Very sorry for the interruption. I don't know what happened to the network. Okay.
We didn't believe that you are in Amman.
Yeah.
It's true.
Okay. So now we already merged these two activities together. So no need to have both. Okay. What else we have here? People could not afford the cost of the health services. We already mentioned here. We will provide free medicines here. So I think here I mean already covered.
Okay.
Okay. So now we have all these. Let's see how the effect will be. So before we have the health service providers with low capacity and so on. Now health service providers with low capacity. How can we change it? We can say after we did all the trainings and tools and things, we will say, of course, the figure we mentioned before, it's 24 health service providers. So we can see here 24 health service providers had with
enhanced,
yes, with enhanced capacity, okay, tools to provide high quality services. We can just do like this. If we are not satisfied enough, we can say received capacity building and tools to provide high quality services in the targeted district. Okay. How about this? The infrastructure of the health facilities. Instead of poor, we will say improved. We can also just say improved with enhanced support and supervision from the health authorities. Okay, I think it's good now. Also, what else we have? Okay, we have people in targeted areas, lack of health awareness. With improved awareness, health awareness, and with improved awareness. And for I think we need to think about this. Improved awareness and willing to support reproductive health and vaccination services in their community. Okay, now it's done. Satisfied? Are you satisfied here? Of course, as you notice here, it's not smart. This is not smart because we didn't mention the numbers. Here it should be in infrastructure. We can see 12. Did we mention 12 or 10? 10, yes. 10 health facilities with improved improved infrastructure. Okay. Improved infrastructure and okay with okay, and operating with close support and supervision from the health facilities. Now is much better. And here we can see 5,000 people in targeted areas with improved health awareness and willingness to support the services that is mostly needed by women and children. Okay, let's go to the outcome. How could this be changed if people are supporting health facilities infrastructure and supervision is there, and also the service providers have, let's say, much better capacity? We will end up in having it should be as long as I mentioned here 10,000, we can use the same, so we can say 10,000 or 10,000 of the most vulnerable people, especially women and children, received adequate health services they need to save their lives with improved, let's see, okay, received. If we want to reflect the results or the impact, we might not only say received adequate health services, we could say with improved health conditions or whatever, just to show the change. But also we can let the donor usually accept it if we say received adequate health services that meet their need, that met their need and saved their lives. Sometimes you don't really find the best sentences. I will just stay like this unless you help me to write it in the best way. Okay. Here, increased rates of morbidity, it would be what? It would be just like the opposite. It will be just decreased rates of morbidity and mortality in the community, especially among high, okay, in the community. Okay. Okay, perfect. So I think now we are good. We are good. I see you commenting about the materials. So let's hope that you can download them. Let me just finish commenting about this, and then we go to make sure that you have the materials. So we are done. Now we are having a theory of change. So this is a theory of change, basically, for this project. It's ready to go back to the logical framework and work on that. I think we need a break. Should we have a break or no? What do you suggest?
I guess we continue because it is.
Yes.
Can we continue? It's much better than we take a break now.
Yeah, it's not long break, just 2 minutes, 3 minutes, so we can move around the place and come back.
Okay. Stretch our bodies.
Yeah, we need to stretch.
Okay.
So let's have 3 minutes and come back.
Okay.
Okay.
Thanks.
So hopefully you're all here again. Let me make sure that I didn't stop the recording. Okay, it's still there. Okay. Yes. Any questions at this level? I will see the chat. So Olga, you had the link, so they can have the recording, because I think we need to have it in the YouTube, would be much easier. But still, yes, it's good. You could.
So for me, I couldn't open the
link was not.
Yes, the recording of yesterday. So maybe it's waiting for the YouTube.
Yeah, I will. Yeah, we should try, because I don't know if the download would be easy.
Okay.
I will try to do that.
Thank you.
Maybe I should not do it now, because it might affect the session.
Sure. I guess you are in Bani Matar.
Yeah.
Project area. So do it tonight, I guess.
Okay. Okay. Generally, let's upload what we did today, so that I make sure you download it and confirm that you receive it without any. Okay, I will. So Excel sheet for today, 14th of March. Problem analysis and theory of change. Okay. I thought I am sharing with you the. Okay, so now I'm uploading it. Please confirm you have it. 14th of March. Should be saved, so that we don't see that we forgot to save. Okay, saved. I will load it again. So 14th of March, saved. Yes, so now we have it here. Is there any way that you all confirm receiving it? Just go to profile and go to shared center. Yes?
Yes.
Can you please explain how can we reach the shared center?
Yeah, so you go to profile, and are you already in portal?
Yes.
Yeah, you go to profile, then you go to shared center.
Okay. Are the materials there as well?
Yeah, so now this is the one I uploaded today. You click, then download.
Oh.
I just want to make sure that it includes all the data we were working on today. So this is the problems tree, and this is the theory of change. Yeah, it's available now. Is good. Because for the one of yesterday, I was surprised that when I downloaded it, it was not available, and even in my laptop, it was not saved. Very strange.
I mean the materials of the course, the PowerPoint.
Yes. So now I will add the PowerPoint. Session today we had session 04. Okay. For the session number 3, I shared it yesterday, so it's already here. Today session number 4 and session number 5. Zero 5. Okay.
Dr. Adil,
Yes.
even the session we shared yesterday, can you repeat, reshare them again, please?
They are available. Can you see it? It's here.
You shared them again.
They are still available. I mean, is there any problem with that?
I opened session 00 and it's empty.
Let me see. Can anyone confirm if it's available or not? It's here. It's available.
It's open to me.
Maybe the network is not good enough where you are now.
Okay. It's there. I refreshed the browser. Thank you very much.
Okay. Who is asking, by the way? I didn't read.
Here.
Okay. So so please try to download them. Maybe some of your colleagues also would help. If
okay,
there is.
Thank you very much.
You are welcome. Okay, maybe someone would share them with Maram. If you could download them, please send them by email to Maram.
Okay, I will send her in her email.
Okay, great.
I'll send it to her.
This is great. Okay. So now what we will do is that I was thinking to go to another if we have any theory of change or maybe problem analysis for someone of you, but I'm not really sure that you already had that chance to work on your problem analysis and theory of change, which means that we could take the chance to develop the logical framework for one project.
Hello, Adil.
I don't know who was talking.
Hello. Yes, me, Baraka.
Yes, Baraka.
I want to ask because I cannot access those information unless I have seen the Olga email here. So until I create the proposal, and then I can be able to the shared center. Is it?
Okay. Can you open your account like me, like this?
Yes.
Yeah. So you go to profile.
To profile.
And then shared center.
And then
to the shared center here in the list. Do you see the? Do you see the pointer here in the shared center?
Yes.
And then
yes. Oh, a shared center. Okay.
Yes. Then you find all the documents. You can click on the presentation and you find it.
Okay. Thank you. I can see that.
Great. So it's great. We need to agree on the next steps before we try to work on, like, we will not develop the whole logical framework, but part of it, because tomorrow I think we will spend the first part of the day developing a logical framework. Then we go to beneficiaries, and we will also work on monitoring and evaluation. So what I was thinking is that we need to agree on next steps. So for example, I need to see everyone's proposal added, because now we have only 7 proposals. And also we need to make sure that the things we achieve, we update the system, because we need to see, because now, for example, 7 projects, only 1 that is 12%, while all others are still 0. All others are still 0. So please, we need to finalize all of them. We have 12% for David project. We have 12% for Najwa project, and all other projects are still 0. We really need to push for that. Okay, Nader added a project. Athir added.
Dr. If
Yes.
I may say, David texted me that he faced some problem with portal when he tries to complete his project. Can you ask David to share his screen right now and show what kind of problem he faced?
Yes, sure. David, if you are, just want to make sure he's still available. David, are you here? I think
yes.
Okay. Do you are you able to share your
Let me try.
your screen? I will give you
Inshallah.
Thank you.
Okay, let me see here.
Yeah, I already made you co-host.
Where do I do that? Oh, I see. No? Where
Yes.
do I?
I will stop sharing, and then you go to the share screen, like down in the screen.
Yes. Can you see?
We are about to see, but now we see the desktop. Yeah, maybe.
Okay.
Okay, great. You can close. Yes, you can close from the X.
Okay,
Yeah,
let me show you what is happening when I go to proposal.
Yes.
I'm waiting in part for the material that we covered yesterday. So I have entered Latin text in some of the fields, but that's not the problem.
Yes. We will update you. I think, Olga, while we finish this, maybe in a few hours, we'll be able to send you the Excel sheet, the updated one.
Thank you.
Yes, I will make it right after the training. So it will take maybe half an hour to complete.
It was very strange that no one of us confirmed that he received it or she received it yesterday. So we closed directly without confirming.
Okay. It's still loading.
Okay. So you think it's slow at your side? Yeah.
I guess so.
So let's say, yeah, sometimes, yeah.
Okay, it says here, please complete this information.
Yes.
So I attempt to go there, and it doesn't allow me.
Okay, let's see, because yeah, let's see. Okay, select a contact. Maybe you need just to add a new. Okay.
I tried both a outside person as well as someone in this list. I don't have phone numbers of people.
No, you
so
can
I cannot
no, you can add yours. Add your.
I tried.
Let's
I will
see.
try it again.
Phone, any phone, yes, and job. You can just add. Okay.
Save.
Okay, let's see if
It says unauthorized.
Oh, Aisha, are you with us? Aisha?
Probably we need to give more rights to all participants.
Yeah, I know, but there should be. Let me check. It should be authorized directly. Okay. Let me see. User management rules. Okay. Permissions.
I added you. I searched for your phone number. I entered it.
Still
it didn't work either.
Okay, so I think now I okay access meaning. So we will give all the authorities. So we give all the authorities for everyone. Maybe you need just to you need just to refresh the page and see. Let's find out.
Maybe because his internet connection is weak.
No, it mentioned unauthorized. That's the problem.
Huh, okay.
Yes. So let's. I think David could refresh your page, and we go back again. Because I give you like all the permissions. And now we can confirm. Okay.
I don't know what I just did.
Okay. No problem. I think it's just updating. It's trying to refresh. Okay, we will find out.
Just do not press anything. Try to wait until the downloading of the page complete.
Tamam.
When I try to download session 1, it saves in web page. Is it how it looks like, or it should be in another way?
So it should be the same, like it should be PowerPoint or Excel sheet. Are you able to confirm this?
No, it's not like that. I did that many times and it is saved in web page.
Nedwa, I will share the file with you. Tell me what is the file that you have?
All of them.
Okay,
I tried the 3 and they are saved in web page.
Let me
maybe
check.
you have a problem in your browser. I downloaded all of them. I will share with you I will send it to you later.
Thank you in advance.
Hello, Dr. Adel.
Yes.
I have shared our project title. Maybe you can see it.
Okay, I'll see it right now.
Yeah.
If we still have time, can I have some questions?
Yeah, of course. We have a lot of time. Yeah, for sure.
Thank you.
Yes,
okay.
Go ahead. Sorry.
Thank you. The first question regarding the, I noticed that everything we mentioned before, it changed to be different things. Example, the effect on responsibility and entities changed to be activities. Regarding the activities here, are we going to reflect them, even they are main activities to sub-activities, all of them will be in the logical framework? This is one question.
At first, we changed the causes to activity, right?
Okay.
And the effects, like on the upper part, the effects to outputs. The effects to the okay, sorry. So the effects to outputs and the harms to outcomes. What else? We have the negative, like the impact on the society negatively will become positive output. And now you talk about sub activities, right?
Yes.
maybe I will just comment on David and I come back. So David, I think what you need always to do is just to do ngo.portal365.org every time you want to access.
I have 2 accounts now.
Ah,
I have
okay.
one account that's Adra Romania,
Yes,
and it's mixing me up because I try logging into the training one, but it's defaulting.
No, you can go to your profile. You can go to profile, and there is what is called like down. You go down the list. So this not settings. Can you just increase the screen so that we can see the list? Yeah. So yes. So now you can do switch NGO. Switch. Okay. You can, and then you do login with different account. Yeah, you can select the one. Yes. Yeah, so as long as you are using the same email, so you have both accounts.
So am I the only one having this contact issue?
In terms of the proposal, I think we need to try again because I give you all the permissions now, just to check for the last time, and we will come back to you. Is there any possibility?
Yes, I'm sorry, I'm holding everybody up.
No, but it's good so that we make sure it's done. And at the same time, I'm seeing the proposals of others. I see Baraka already added the proposal. And yes, so hopefully you also work on your proposal. So usually I need everybody to download the Excel sheet and work on your analysis and theory of change. So everyone should do that before we copy paste to portal. I think yeah, add a new. Yes, add a new.
Can you do this bilaterally later on?
So now it's saved. So it's saved. You just do cancel, and that's it. Yes. So it's solved. Yeah. So the idea was related to permissions issues, and it's very strange.
See, it wouldn't allow me to come to logical framework. Now I am here.
Yeah, now you are in logical framework. You can click on a link with program's strategic objective.
Oh yes.
Mm-hmm.
All right.
You can select one or more, and add percentage should be 100%, for example.
Well, that was another thing. I had trouble choosing donors.
Okay. We can go back for that. It's fine.
I don't want to take up someone else's time.
Yeah. Thank you so much, David. Can you discuss this issue later on bilaterally with even Aisha?
Yeah. We can. Yes.
Yeah.
Maybe David with Olga anytime they can discuss about it.
Yeah. Thank you so much for your understanding.
Okay. So now, David, I will go back to okay. Is there any question before I do something from my side?
No, thanks.
One more question from my side, please.
Yes, so we were at your question. So the sub-activities, usually we don't add them at the proposal level. Usually the sub-activities, we do it while we are already managing the project.
Okay.
So for example, just to make it more clear, where is the, let me show you.
That means here we are dealing with the main activities only.
Yeah, usually once you work on the proposal, you work on the main activities, and only once you are doing the implementation plan during the management, then you go to do the very detailed activities. Usually the donor wants the main activities, and even though, for example, when you are doing the work plan, like you will only have the main activities. You don't need to do sub activities during the proposal development. In the same time, the timeline, I mean, when you do the time, you don't need to make it like on weekly basis. You need like the donor needs to see it on monthly basis. So you will just click on the activities every month. So once you work on activities in the logical framework, you will have them directly in the work plan. So you need just to select the month where you will be working on. Yeah, as long as you all need the materials, I think Aisha or
Dr.
Olga will send you email with all the materials until now. Yes, Safwan, you have a question?
Hello, Dr. Del.
Yes.
Sorry, nothing.
I could not hear you properly, probably. You were addressing our roles today. You said, what should we do?
Yeah, so what we need to do is that, let me share with you the Excel sheet again. So please, everyone, make sure you have the Excel sheet. This is very important. Yes. And then you decide the problem parties like this. And then you go to problems 3, you work on problems 3 analysis, and then try to do the solution 3. So exactly as we did in this project.
Okay.
So that's why please make sure you download the Excel sheet now. Make sure you have it, because you will work on that. Once we finish the solution 3 and logical frame, the theory of change, we will be able to develop the theory of change in a very easy way. The theory of change will be very easy, I promise. But if you really developed the problems 3 and you understand it, and then the solution 3, that's why please work hard on them, because it will be helping us to develop the logical framework.
Thank you, Dr. Del. I got to you. I think we are, because I was not there when you were developing the problem parties. I will review the video and then I will start from there. Thank you.
Yeah, that's great. And we will share the recording. So also you will depend on the recording and you follow all the steps. So you feel like, yeah, I'm going on the steps that are really clear.
Thank you, Dr. Del.
Thank you so much. Yeah, so what I was thinking to do is that just to show you, for example, how we do develop the logical framework. So today, like we did the solution 3. If we want to develop the logical framework after that, what we do is that we come here and we copy paste the impact, and we go to logical framework. This is the outcome already. It's ready. Let me see why it's copy pasted like that. Yes, I will change it. Yes, now it's good. So this is the impact. Then we go to output 1. This is output 1. We do output 1. We copy paste it. So let me make sure. Yes. Okay. So this is output 1. I go to output 2. We go to output 2. Ready. Then output 3. So you find out while we finish the solution 3 and the theory of change, we are having almost the most important parts of the logical framework. Now we copy pasted impact, outputs, and then I go to activities. So now this activities, we have like, let's say output 1. We start to copy paste activities of output 1. So same way, this is output 1. We have the activities of output 1 ready. Output 2. Sorry, I'm copy pasting on the indicators. I'm really sorry for this. So I will move this activity. We will leave the indicator free because we will work on that tomorrow. So I'm just copy pasting to the right place. So now we have activity 1, activity 2, activity 3, and so on. The only missing part from the logical framework will be indicators, targets, verification methods. That's what we will be covering tomorrow, and also we will have a session for the risks and how can we do the risk analysis and mitigation measures. So in general, once we do the problems analysis in a very clear way, we will be able to reflect it to solution tree, and then the solution tree will be reflected to the logical framework. Okay. Okay. So now, what I was doing. Okay. Conduct 12. Okay. Okay. So now activities are done. Output 1 is done. Outcome is done. And the same I will do for the activities of output 2, and the same for activities output 3. And then what we do, what we will do like tomorrow is that we convert every activity to indicator. So for example, here we mentioned that we will conduct a training for 24 health service providers. The indicator is usually a question. So it's like a question we have for the activity. So we see what is the number of, let me convert it. How can we make the activity indicator? We see what is the number of health service providers trained. It was training. Now I will use past tense, trained in integrated management of childhood illnesses. So this is a question, but it's not already an indicator. First, I made it what is the number of, and what I will do now is that I will remove what is that. Now it's indicator. Number of health service providers trained in integrated or on integrated management of childhood illnesses. Okay, sorry. Usually when we write indicator, we change the number to this way, number of. So we put a hash instead of the word number. If it's percentage, then we do like this, percentage of health service providers. So this is the way we develop the indicators. The same will be done for this activity. How many health service providers provided? But before I go to the second one, usually we have a question. What was I will keep it as a question. What is the number of health service providers? So now we have the target. The target is the answer. So we mentioned that we will train 24 health service providers. It means that we have 24. But how many men, how many women? So for example, we could train 12 health service providers, men, and 12 women. Of course, boys will be 0, 0, and the total will be 24. Exactly like the same we have in the activity. And then the verification method is what is the document that we will give the donor to prove that this training is done or that this indicator is achieved. So usually, as long as we will do training in the activity, the verification method, the document we will provide the donor is the training report. So that's the verification method. So now once we have the question, the answer, the document proving the answer. Once we have these three, then now